Guys, literally, what the heck? It feels like just yesterday I was recording my surgery rotation recap with you guys, and now apparently it's a year later. I finished all of my core clerkship rotations, and this is the final rotation recap. For all of my loyal subscribers, thank you so much for tuning into my videos. Welcome back. You know the drill. For everyone that's new here, hello and welcome. My name is Morgan. I am a now third-year medical student at NYU Grossman School of Medicine in New York City. And even though I'm just starting my third year of medical school, I've already finished all of my core clerkships because we have a super weird curriculum. So essentially, my first year I did preclinical. After my first year, I took step one. My second year, I did core clerkships, and then I just have third and fourth year to kind of like vibe, explore, apply to residency, do research, do all of that good jazz. But after every rotation, I've done a rotation recap, so let's just go ahead and dive in. I just finished my last rotation, ob-gyn. So the first thing that we always talk about is what was my rotation schedule like? So my rotation was 5 weeks long, and every week it was something different. My first week was L&D days, which was so fun. I am interested in family medicine, so I was thinking that I was gonna enjoy L&D, but this rotation was really important to me because I wanted to see, like, do I actually want to deliver babies in my future career? Because you can do it in family medicine, but you don't have to, of course. And I loved it. So L&D days was mostly like 11-hour days. So I'd get to the hospital a little before 7. We do sign out. And then usually we try to like hit on anything that we need to do for our postpartum moms. So hypertensive counseling or circumcisions for the babies or birth control counseling, birth control placement, different things like that, just checking in on them. And then I would kind of like start introducing myself to all of the people that were currently birthing on the floor. And that was kind of like how the day went. Whenever anybody we got to see all of the different like OB consults as well. So I don't know what the cutoff is, but like after so many weeks, like if you come to the ED, then you automatically come up to the OB triage area. So I was seeing all of those patients as well. And then of course, like got to see a lot of different deliveries. I got to see some vaginal deliveries. I was able to help deliver the placenta, got to see some lacerations, which is terrifying. And then I also was able to scrub in on a lot of C-sections. I got to see C-section deliveries for breech babies, twins, meconium aspiration, protraction of labor. Like, it was insane. Super busy. We had to do like all the birth certificates for the kiddos. We had to make sure that they all had like breast pump forms for moms that wanted to breastfeed. So busy, but I really did enjoy it. And it was like sun up to sundown. Like as soon as I got there, like I was just go, which was fun. The next week I did nights. This is the only rotation during like my medical school core clerkship year that we had to do nights. And so that was 6 p.m. to 7 a.m. I think, but I never stayed until 7 a.m. I usually got dismissed. It was a lot like slower. I don't know. I guess people just don't like have I don't know. There just wasn't as much to do overnight, I guess, because like you don't have the C-sections unless they're stat, and then you also don't have like inductions of labor. Usually you start theirs early in the morning. So that was nice. Most times I was getting out between like 2 and 4, but during that time we covered L&D, we covered postpartums, we covered OB triage, and we also covered the GYN like inpatient patients, and then also the GYN consults. So that was a lot busier in that sense, but there was just like a lot less to do. It was really nice. I still got to see a lot. I got to see some scary like stat C-sections. There was one night we did like 3 C-sections back to back, which is terrifying because you never want to be a stat C-section. But I learned a lot. And then I did a week of reproductive choice, which I am so grateful that I go to medical school in a state coming from South Carolina, that I go to medical school in a state where I was able to get that education as a medical student. So that is an opt-in week for us. So you can rank it or not. And so essentially that was more outpatient based in terms of counseling patients who desired termination of pregnancy, and then like counseling them on medication abortion versus procedural abortion, and also doing growth scans to see like how many weeks they were, because that also would decide like the abortion that they were eligible for. And then we had 2 procedure days, and so I got to see some procedural abortion, so dilation, DNCs, and also DNEs, which was very overwhelming. It's very emotional. It was a lot, but I think it was really good to be able to get exposure to that, to see how you counsel patients in that situation. And also I think it's just amazing that like I said, like to be able to live in a place, the institution that I rotated at, I was at Bellevue Hospital. It's it's one of the public hospitals in New York, and the like hospital sets the rule, and so the rule is 26 and 6. So 26 weeks, 6 days, no questions asked, you can get an abortion. And of course, like at like 26 and 6, you're usually like, it's an inductional labor for termination. But yeah, so I thought that was really interesting, and I'm really glad that I decided to do that week. And then after that, I did outpatient. That was a shortened week because I was at the AFP conference, which if you haven't seen that video, make sure to go and check out that vlog. I'll put it up here for you guys. But I did get to do 2 days of MFM. So it was maternal fetal medicine. So essentially counseling patients that have high-risk pregnancies, whether they're IVF pregnancies, whether they're have preeclampsia or diabetes, different things like that. And I will say that day I was very much like, wait, I'm kind of obsessed with MFM, and if I didn't have to go through a whole OB residency, like I would totally do it. But unfortunately, like I don't love surgery, and I couldn't imagine like the second year residents, they scrub into all of the C-sections. So that's just not gonna be my thing. And then I just had like general resident clinics, so I was just like kind of doing annual GYN visits, and also like uncomplicated pregnancy checkups. And then my last week, which was really short because what did we have that week? We have our OSCE and our shelf exam in the same week. And so that's like a 2.5 day week, the last one. And so that was my benign GYN week. So I feel like I got super lucky because I am not a surgery girly. So it was so nice that I only had like 2 days in the OR, or 2.5 days in the OR. But I got to see like a laparoscopic hysterectomy, which was so cool. And they also like were taking out like fibroids also. Like this lady had a huge fibroid, and also we took out her uterus, and like I think we left the ovaries, but yeah, so we took out like the uterus like literally through her belly button. And that was one of those moments again where I'm like, wait, this is so cool, surgery is so cool. Got to see like Bartholin cyst removal, and a bunch of other little things. So it was really cool. So that was my rotation schedule, and like a little bit of like how the rotation went, but we can really dive in now into how the rotation went. I thoroughly enjoyed it. I think that the hours were so long. I felt like I was back on a surgery rotation. But I think it was like my last rotation, so I was just kind of like vibing. Like if I had to do another rotation after that, I probably would have been very upset because I was so exhausted. But because it was my last rotation, I just was kind of like in la la land and like delusional and very happy. And so we got it done. So I would say it was very busy, but overall I really loved labor and delivery, of course, more than I loved like GYN. And I also really loved MFM. But I definitely did really love the babies as well. Like I loved like pushing with the moms and counting with them. But whenever the baby came out, like I just wanted to hold the baby. And I thought it was so fun because when we were doing like, when we were on postpartum, like we had to put the next one on. And of course, like they're all about like mom and baby, and or parents and baby having time together like right after birth and postpartum. Of course it makes sense, but like who's gonna watch the baby while you're putting the next one on? So like if the baby just this baby was like already so spoiled. Like anytime you put it down, it just started crying. And so of course, like the whole time they put in the next one on, I got to hold the baby. And the week that I was on L&D, it was like my intern's second week ever because I did the rotation in July. And so like it took her a little bit longer because like the attending is having to like talk through things because of course like this is her second week being a doctor. And so it was amazing. It was cool, but of course it took her like a little bit longer. So it's just more time that I got to hold the baby. So I think that just goes to show that like I love moms and babies, and yeah. Now we're gonna dive into the stuff that like you guys are really worried about, which is studying for the shelf exam. So for the shelf exam, I got an 80, which I'm happy with. Once again, like our shelf exams at my school only count 10% of our grade, so it's like not that deep to me to like try to get like 90s 100s. Like personally it's just never gonna be that deep. It's only 10%. Our rotation was 5 weeks, and also an 80 is above average, so I'm happy with it. But how did I do it? So I did the same thing that I've done for all of my other shelf exams. I did the on-king card, so I'm still using like the version 11. That's like the last free version that they have. So on-king V11, look at tag, and then you go to shelf exams, and then you go to OB-GYN, no dupes, only step 2. So that was like 1,025 cards, and so I think I was doing like 50 cards a day, however many. I just did like 1,025 divided by the number of Ds that I had remaining for the rotation, and I just like cranked them out. And I feel like there's also a little bit of like pediatric stuff that comes up as well. So because I'd already done my pediatrics rotation, that was helpful. And then I did all of the UWorld questions. There's overlap, but for me it was like 500 UWorld questions, so grinded through those. I did one NBME practice exam, whatever the most recent one out is. I have no idea what my score was on that because I did it while I was like traveling to the conference, so I don't remember and I can't find it right now. But I like wasn't really worried because I've realized that like my score on the NBME practice exam doesn't always align with what I do on test day because it just depends. And of course like the NBME practice exams, like those are questions that like they've thrown out or retired, so yeah. But I also did watch the Dr. Hayil video. I'm obsessed with Dr. Hayil videos. He's amazing. Unfortunately, there's no Emma Holiday video for OB-GYN, which is insane because like I'm so used to grinding through Dr. Hayil and Emma Holiday videos the night before, but there wasn't one. But honestly, I think it was okay. Like I felt very comfortable with UWorld, and like I feel like I was understanding the topics, so I was totally good. And my school also had like weekly didactics, and we had weekly quizzes, and then with our OSCE we also had like a clinical reasoning exam, which was honestly like it was fill in the blank, but just like pulling it out of my behind was really hard. And so because that was like fill in the blank, and that was a couple of days before the shelf, I felt like the shelf was like much easier because really hard weekly quizzes, and also like that clinical reasoning exam. So what are my tips for the OB-GYN rotation? My number one tip is like have a document with abbreviations. I'm gonna try to create one for you guys, but until then, like you can just Google like OB-GYN rotations. My intern, who I'm like kind of obsessed with, as long as she gives me really good evals, she had like OB-GYN abbreviations that she created, like a document, and let me just show you guys. Like there are literally so many, and I could just keep scrolling, but it's everything from like you need to know your G's and P's. So like what is G3P2012 or 2011 or whatever like that. So like no, it's like G is like the number of times they've been pregnant, and then like P's is like the birth outcomes or something, and then it's TPAL, so it's total it's term births, preterm births, abortions, so that's induced or spontaneous, so miscarriages, and then living children. So I was like and you need to know this, like whenever you're getting history from a patient in OB-GYN, like they're going to want to know their G's and P's, and so just like make sure you're familiar with that. But then also like you want to know like what is TOLAC versus VBAC. So like TOLAC is like trial of labor after cesarean versus VBAC is like vaginal birth after cesarean. Let me just like pull out some other ones. There's just like so many, like D&E and D&C that we already talked about. AFP, you know, like alpha fetal protein, but like EDD, estimated date of delivery. But I swear, like the first couple of days when I was sitting in rounds, like I was like, are they even speaking English? Because there's an abbreviation for everything, and of course like the abbreviations overlap. Oh yes, whenever they're doing like growth scans, like they like FH is like fetal heart rate, but it can also be fundal height, and then you need like FL is like femur length. Like there's just so much. So I'm gonna try to create a doc for you guys like before I start dedicated, and I will drop that in the description below so you guys can download that and just like have that on your phone, just like have it out while you're rounding, because you're not gonna know what's happening. Another thing that's helpful, especially on L&D, know how to read fetal heart tracings and what the next steps for interventions are. So I'm sure they have this like everywhere, but like our fetal heart tracings are on a big screen, and so sometimes like people are busy, and there should always be someone watching the fetal heart tracings, and like also the monitor is gonna go off if like there's things happening. But like sometimes they'd be like, hey, that looks kind of weird. Or when you go see patients and they're in OB triage, they're usually getting an NST, which is a non-stress test, and like for them to pass the non-stress test, they have to have so many accelerations. So you want to be able to like read the fetal heart tracing and be like, okay, this patient has had like a reactive non-stress test, which is good. Reactive means like the heart rate's within 110 to 160 for baby, and then also like they've had 2 XLs in the 20 minutes. But I think that's so important that you're able to like read that. Of course, someone's gonna like have to go behind you and check before they like discharge a patient, but just being able to read that, and also like if you're in the room like talking to a birthing patient and you like see the monitor, you can just be like, hi, I think we need to look at this. And the mnemonic that I love is VEAL CHOP. So VEAL is variable, early, accels, and late, and then CHOP stands for cord compression, cord, head, okay, and placenta. So basically like it aligns, and I'm gonna like put something on the screen so you guys can see, but you can think of like variable decels are caused by cord compression, and then early acceleration, I have to like write it out or I can't think. Okay. Variable accelerations are caused by cord compression, and then you have early accelerations, which are caused by head compression during contractions. Then you have accels, which are okay, and then you have late decels, which are caused by like placenta issues, like placental insufficiency, your uterine tachysystole, and all that good jazz. You also want to know like the stages of labor. So like the first stage of labor is the start of labor until they're like 10 centimeters dilated, but then you have within that, the active stage of labor starts at 6 centimeters, and that's kind of like when the timeline starts for if people are having like arrestive labor, because you're supposed to progress like 1 centimeter every hour, and then it's also like different depending on if you have an epidural, if you're not, if you're a null-up versus multi, all that good jazz. And then you also have the second stage of labor, so that's like fully dilated to birth of the baby, and so at that point like you're tracking based on fetal station. And then you also are going to have the third stage, which is delivery of the placenta, and then there's also like other milestones that you need to know, like once they've ruptured the membranes, you have like so many hours before like you start worrying about chorioamnionitis. I don't know if that's how you say it. Anyways, so you need to start worrying about that. All that good jazz. So many fun things to think about. Also, you want to learn how to give short presentations. So like start like channeling like your surgery time. And if you haven't watched my surgery video, make sure you go and watch that before you do OB-GYN, because I think there are a lot of similarities in terms of like the pacing of it. Of course, like when you're on GYN, you are going to be like essentially on a surgery rotation. But you know, when you're like presenting someone from triage, like they don't necessarily need like the full like SOAP template. Like they just want like a quick overview of like, is mom and baby, like, are they okay? Are they not okay? And what are we gonna do about that? And then like you can also like add in later, but sometimes like they're running to a delivery, so you just want to give like a brief TLDR. And then also like in all of your presentations, there's 4 things that you always want to ask. I'm gonna type it out because if I don't type it out, I'm gonna forget. And this will make you look so cool on your surgery rotation. So in every presentation that you're doing, you want to know if someone's coming into like OB triage, someone's pregnant, are they having contractions? Are they feeling baby move? Are they having any vaginal discharge that's different from their baseline? And are they having any bleedings? And these are just like things to think about. Like if they're having contractions and they're like 15 weeks, like that's really important. They may be in preterm labor. But also like if they're 10 weeks and they're not feeling movement, that's fine. But if they're at 30 weeks and they're used to feeling baby move every day and then they're not, like that's a big red flag. Like we probably need to get a probe on belly like ASAP and just like visualize baby and like make sure there's a heartbeat. And then also like vaginal discharge, that's something like have they ruptured their membranes, and also like bleeding that's worrisome for like miscarriage, but also it can be like benign, like bloody show, different things like that. So you always want to ask that and like say that when you're giving your presentation. And then just remember like your other surgery tips, like practice your knot tying, practice your suturing, and then like practice how to do post-op checks on patients, whether it's like after a C-section or after the GYN surgeries. And I don't think I use like different, I don't think I used any like new apps for this rotation other than, yeah, I just used UpToDate and Amboss, which I've been using for my other rotations. But yeah, it's been like a week and a half since I finished my OB-GYN rotation, or like 2.5 weeks, because like we have like this, I don't even know what it's called, like clerkship skills week or something like that. And then like I've been on vacation, but this is bringing back so many memories. I really did enjoy this rotation. It was so fun. I think OB is like a great rotation, like push you out of your comfort zone, because like you're literally interacting with patients at a time that's like so stressful. They might have like weird family dynamics and all that stuff, but it's like a perfect combination of like kind of like medicine and surgery at the same time. So good luck. I hope this was helpful. Make sure to like start looking up those abbreviations so you'll be prepared, and good luck with your OB rotation. Make sure to like this video, drop a comment if you have any questions, or drop a comment if you love the video, and make sure to subscribe so you don't miss out when I share my next video. Take care, guys.